So welcome everybody. It's a pleasure to be here in Barcelona today at the HFA Congress 2026. We are here today to discuss the heart failure nurse at the heart of heart failure care. My name is Camilla Hage. I'm a heart failure nurse from Karolinska University Hospital in Stockholm and also an associate professor at Karolinska Institutet. And with me here today, I have Martha. Please introduce yourself.
Good morning, Camilla. It's a pleasure for me to be here today and have this discussion together. My name is Martha Kyriakou. I'm coming from Cyprus. I'm a lecturer in a university in Cyprus and currently chairing the Association of Cardiovascular Nursing and Allied Professions. So thank you for inviting here
Nice
today.
to have you here. Anna.
Thank you. I'm Anna Strömberg, and I am a heart failure nurse specialist from Linköping University Hospital in Sweden. And I'm also a professor of cardiovascular nursing at Linköping University, and alongside with that, also the Associate Dean for Research and Research Education.
An honor to have you here. And Tini.
Hi, we have a big Swedish delegation today, but hi, I'm Tini Jarsma. I'm a professor in nursing at Linköping University, but I'm also a professor in nursing at the Utrecht Medical Center Department of Cardiology in the Netherlands.
Thank you. It's an honor to have you here. So let's go on and see what we're going to discuss today. There is an increasing acknowledgement of the heart failure nurse in the multidisciplinary team today. Beyond the management of the rapid up titrations and the early visits after hospitalizations, the heart failure nurses do a tremendous job in very different areas, all from education of the patients to coordination. And this is also shown as it's a requirement, many of the accreditation programs like the iCare program, for example, where educated heart failure nurses are required for being certified. So some of these things that we actually do that's so important, Anna, what do you think about education and self-management for the patients?
Yeah, I think that with the more and more advanced heart failure treatment that we have, and also the increased evidence of the good effects of actually patients doing self-care, I think it's really our responsibility in the heart failure team to give patients support and education to manage self-care and to identify the challenges that patients have and when they are in need with caregivers and other support from the healthcare. And I think the nurses have traditionally and now also seen this as a very important role in their professional role, and to have like conversations and follow up with patients with respect to self-care. So that is definitely a very important area, and also an area where a lot of heart failure nurses are also doing research and bringing that evidence to the table.
Do you also think that the patient perceive this as very important, having this education?
I think many patients think it's very beneficial to have a knowledge about their disease. Then, of course, through different stages, people are more receptive to knowledge, and there are also some situations where we have to be attentive to see that maybe this is not a good timing to overload a stressed and anxious patient with more information. I think that's all in this relationship with the nurse that we've seen, for example, through the nurse-led heart failure clinics, that's very crucial for adherence to treatment and for psychosocial outcomes.
Is there any special areas that you think you would like to highlight more? What's more crucial, or is that up to each individual patient?
I think in general that we have to acknowledge that patients can do a lot. It's really shown that it influences both mortality and morbidity to do self-care. So I think it's our duty to help patients to do better self-care and highlight the importance, because I think some patients feel that doesn't really matter what I do. How important is it? So there, I think that's a very important aspect to emphasize.
Thank you.
Can I add something, Camilla?
Yeah,
Yeah,
sure.
because I was thinking when you talked about the heart failure clinics, etc., and that there is such a big difference in Europe, and that we do not have this one, stone hard definition of this should be done in the clinic, and this is how it should be organized. And I think, like you said, we have to look from the patient view and the patient perspective. What does he or she need? And then in all our different countries, we probably have different ways of organizing the care. And there you can also see a big change in, like, when we started in the beginning, it was a different role than now the nurse practitioners have in some countries. But in some countries are also just starting up to have an increased role of the nurse. And I think that's so nice work with, Heart Failure Association and ECNAB to have that the multidisciplinary team involved in different ways.
Yeah, that's truly important.
Yeah.
Yeah. Another aspect of what heart failure nurses focuses on is the coordination for the patients. There's so many people involved in so many different aspects and so many different areas. So Martha, what's your view on continuity of care and how they move between transition from hospital care to community care, for example?
It's an adding framework, actually, on what Anna and Tini already mentioned. So to start following the patient from the time of the diagnosis and offering to the patient what they need from the discharge from the hospital, or in some vulnerable cases that even if they don't have to hospitalized. So offering supportive care to those patients, empowering them through those difficult situations, I think it's what heart failure nurses are offering. And as they said before, it's much developed, the heart failure nurses' role in continuity of care. So the coordination of nurses between outpatient care when patients are at home and in the hospital, I think is what heart failure nurses now providing more structure.
Do you have an experience of hospital at home and that concept that's more and more talked about?
To be honest, as mentioned before, it's different levels and services across Europe. I'm coming from Cyprus. Now we don't really have heart failure clinics there. So my experience, it was from a research project. So following the patients after a vulnerable period, after they are discharged from the hospital, offering them telephone support, then meeting with them, educate them, and trying to follow the steps of the patient to see what they need in every time, help them understand what is self-care, help them understand which symptoms they have to recognize and which symptoms have to lead them in the hospital. So that's my experience. And from the patient's perspective, was what we saw. It's that they need that and they are asking for that. So even in a setting that we don't really have a structured programs, up to countries that they have services, I think we have to adapt on the patient's journey.
Yeah,
Yeah.
that's very true.
But I think it's also a very important aspect that, like you mentioned, the hospital at home and also more heart failure care in the community. There you really often see a gap that the specialist care is often very focused and well organized, and it's easy for specialized cardiology units to provide this type of care. But in primary care and community care and home care, where there are so many conditions and there are a lot of elderly, frail, multimorbid patients. So there, I think that's really part of the future to close this gap and have specialist care, primary care, community care working together. And there I also think that heart failure nurses can have a very important role. Nurses, for example, with previous experience from cardiology often works very well in community care and primary care because they have this experience, but now working in a new setting. So I think there is also where some of the future resources of both organizations as HFA and ESC, but also on the national level has to be much more efforts put into.
That leads us on a bit on Tini, palliative care. I know that's something that's close to your heart. That's also something that discussed a lot in heart failure patients.
Yeah, and I think the palliative care should be included in all our work. So it's not only a new service, because we have, of course, palliative care services, but we also talking not much more now about the palliative care approach in everyday work. So also from diagnosis to the end of life, that you have this more palliative care approach and looking at, and palliative care, it is nothing more, nothing less, improving quality of life of patients, decreasing symptoms, coordinating the care, and also have focus on physiological, psychological, existential questions. And I think there the heart failure nurse can have a very good role in coordinating that. It's not to say that we all have to do that ourselves, but play a central role, assess needs of patients, and then think this patient might need like consultation of this person, or go to a colleague that is maybe more specialized in certain areas. So I think in this palliative care approach, the nurse has a very important role. Yeah.
So we see the nurse as a central role in several aspects of care through the whole continuum. But we also discussed several times here that it differs between the European countries, what role the heart failure nurse has. We now have, just these upcoming days, we will have the updated heart failure nurse curriculum in press, which sets the foundation for education of heart failure nurses in Europe. And there's also how we should implement this around Europe. Martha, have you anything you want to touch upon specifically on that?
I think it's great that both the curriculum of heart failure nurses and the curriculum of cardiovascular nursing in general by ACNAP are coming out together. So it's a great opportunity to give a common framework that, based on the availability of services in each country, they can adapt based on this curriculum what the heart failure nurses should know, how they should practice, and how they can facilitate with the patient. So I think the curriculum is a great opportunity for every country to start from the base that they have and scale up with the services they can provide to the patient. Because in every country, what we want is to provide a good quality care to the patients. So with the services that we have and the roles that we have, we can adapt based on those framework and go together down the road for the patient.
And also take that then serious, I think. So the curriculum really gives the opportunity for countries and for institutions to take the role as heart failure nurse seriously. And because I remember, in the old days, some people said, oh, we also need a heart failure clinic. And they printed a nice sign, heart failure clinic. Nurse there, we have a heart failure clinic. And I think now we progressed so much to have a very developed curriculum that says this is the roles and responsibilities of heart failure nurses, this they can do, this they can contribute to it. So I think it's very nice to have that curriculum in place.
Absolutely.
Yeah.
And I also think it's each and everybody's responsibility now to make stakeholders and institutions aware of the curriculum, that we implemented it and really use it as a base for future education across Europe.
Yeah, and that it's really an advantage that everyone does not have to invent the wheel over again. You could take this curriculum and use it, either if you implement it into your structured educational system, or you have to have it as an education on the side, maybe organized by professional organizations. And it also helps us to, like Tini said, have some kind of standards. This is like the basic training that someone called a heart failure nurse should have. These are the knowledges and skills you need to have. And I think that's like a big step forward. And we've had the curriculum for some time, but I think in terms of implementation, we can do much better. And I think that's really the coming year's challenge, to see if we can manage that.
That's really an encouragement to all of us to make this happen, to implement it in each of our own countries, because it's a foundation, but you need to adapt it according to the regulations and the standards of your country. But it's a common ground to stand on and start from.
If I can add something on that, and I will advocate for the heart failure nurses now, we are doing so many things. And sometimes when you are asking what the nurses are doing, it's just for the medications and coordination a little bit. But now the framework, it's something that we can use for the stakeholders and the institutions and the hospitals, and of course have their help to standardize the role and take it down, because it's about communication, leadership, and other things, not only coordinating the care and the medications.
Thank you, Martha. That's an excellent ending for this. Thank you so much. It's been a very nice discussion highlighting the role of heart failure nurses in heart failure care. And by that, I thank you very much. It's been a lovely discussion, and I wish everybody a lovely Congress here in Barcelona.